She was conscious, but she was very critically ill. She was hypotensive. Her blood pressure were very low for her age, and that's very consistent with the diagnosis of septic shock or a very overwhelming sepsis. And we have to start her on some blood pressure medication that we call inotropic medication that will help squeezing the blood vessels to try to support her while we are fighting the infections. This all happened because the infection can cause a lot of the blood pressure issues, and the ongoing sepsis cause hypotension and multi-organ failure. So by the time we treat the infection with antibiotics, we have to support the system and the body organs with the fluids, with inotropic support, and a lot of other agents that will help keeping the blood pressure up to meet what the body needs. So when we give her the fluid and the antibiotics, her blood pressure and her overall numbers got better, but it was very concerning that her legs was even more red and more swollen. And we were worried that this was the source of her infection, and unless we do a quick source control for the infection, all the other supportive measures we were doing, including the antibiotics, the fluid, the inotropes, will not be as effective. So she was in the ICU for 3 days where she had her aggressive treatment. Then she went to the floor afterwards for more ongoing treatment, and she will come back home. So the good news about her case that we were able to salvage and keep her extremity, because a lot of the time what happened when those are not recognized promptly, that they come late or being recognized late. So the intervention that our orthopedic surgeon has performed by opening up, cleaning, debridement, and saving the extremities may not be feasible anymore. So the good thing, with the prompt recognition and early and immediate intervention, we were able to save the whole extremity, and that's a big, big win for a teenager like her. But the big win for her case was we were able to, the whole team at Riley was able to save her extremity from being amputated.
And part of the way they did that was, you said, an orthopedic surgeon was able to drain?
Yeah, that's correct. So they went to the operating room, actually, and they opened up that, infected tissue. They clean up everything, and they kept it open so it can heal over time. And they put some drainage there so it will, suck off all the fluid from there. And that happened when she was in the ICU for the next 3 days. And when we know that, her legs were looking better and she was recovering from infection, blood pressure got better, she was off all the supportive medication she was on,